Today we're going to learn the proper way of giving a newborn baby a bath. The supplies that you will need for this are a towel. Now parents will be using a hooded towel, but most of our facilities don't have hooded towels, but this is what one looks like. So some parents may have some with them. For not necessarily the first bath, we don't want to use this for, but you could use it for a quick bath to do a demo with the parents before the baby goes home. So for your bath, you'll need 2 towels, one to wrap the baby up in after, and one draped into the warmer with your warmer on so that your area is getting nice and toasty for the baby. You'll need 2 face cloths, your baby shampoo. In your facility, they'll be individual size. They won't be a big bottle like this. Most of the facilities use something similar to Johnson & Johnson, but we prefer that you don't use things that the parents brought, that you use whatever your facility is using. The baby's brush, either from their set that the parents get, but most of your cribs will have a supply bag tied up underneath the baby's bassinet with everything you need for the first bath, and a scrub brush or the baby's baby comb will be in there, diaper for after, t-shirt for after, and I like to take the t-shirt and open it up and lay it in the crib so that it also gets warm. You will need a thermometer because you need to take the baby's temperature before the bath and then after the bath to make sure the baby's warm enough to come off of the warmer. Receiving blanket to swaddle the baby in after. And at this point you can put any clothes that the parents prefer on the baby after the bath. You need a bowl or some type of a container for clean water that's going to be the same temperature as the water in your tub. If the facility you're in does not have a nice big counter space to do your bath, then I suggest you do it in the crib. Take some blue chucks and just cover the inside of the crib so that if water spills over, you're not getting it everywhere. And then fill your tub with the water and place your tub right inside your crib and do your bath right there. That's the safest place to do it. For demonstration purposes, I'm going to do it on the table so that we can see how we do this. We're going to open up our towel because this is where we're going to put our baby after they come out of the tub. We're going to put our tub to one side, and you're going to fill your tub with water, and the temperature of your water should be 36 degrees to 37.7 degrees Celsius. If you don't have any other way of measuring the water, then you can put your elbow in and make sure that it's not too hot to your elbow. We have our little Winnie the Pooh device here, and it has a temperature gauge on it. Blue means your water's too cold, red too hot. Right in the middle in the green area means it's perfect for baby and it won't scold or burn the baby in any way. So once you fill your tub up with water, you place this in for a good minute or two and then check the temperature. Once we fill our tub with water, we're going to take a blanket or a small towel and we are going to lay it in so that the baby has some bit of resistance for when they're in the tub. Our baby is over here, skin to skin with mom. We're going to take a quick temperature of our baby. Now, we're usually doing this first bath somewhere around 2 to 3 hours after birth. We try to keep the first hour as uninterrupted as possible for mom, baby, and significant other to bond. And then we can do our shots, our length, our initial assessment, and the baby's bath. So once we have a temperature on our baby, which needs to be above 37 degrees, then we can go ahead and put our baby in the tub. We're going to take baby from mom and put baby in our crib, take our hat off and our diaper off. If baby has had a bowel movement, we want to make sure we clean baby well before we put baby into the tub. I always like to have 2 students doing a bath so that one's there to help hold for safety and the other does the washing. Our baby has not had its first bath yet, so it still has blood products, leftover amniotic fluid, vernix. So we're going to consider this baby to be dirty. We want to wear gloves at all times when we're touching this baby, doing the bath. After the baby's had its first initial bath, our baby is then considered clean, and unless mom is on any type of precautions or the baby has any known problems that needs to be on precautions, we don't need to wear gloves from that point on except to change a diaper. In order to get this baby from the crib into the water, we want to consider slippery when wet. That's your terminology to remember how slippery babies are when we get them into that water. So to hold your baby properly to get from our crib to our tub, we're going to take one arm, we're going to put it under baby's back, and we're going to grab this forearm in this manner. So the baby is resting on our arm. We're going to take our other hand, put it under the leg that's near us, and grab the thigh of the leg farthest from us. We're then going to pick the baby up, not to bring the baby near you because the baby is dirty, so we're still going to hold the baby away from us. Bring it over to our tub, slowly lay it into the water. Release your bottom hand first, and the holder is going to hold on to the baby's arm and rest your hand behind the neck to make sure the baby doesn't sink down into the water or turn its head and drink the water. Now that we have the baby in the tub, we give it a minute to get used to the water, and the entire procedure should not take more than 5 minutes. We do not want to keep